Hello, how are you?
Good, how are you?
Good. My name is Caitlyn. I'm a nursing student from Saginaw Valley. I'm gonna be doing a head to toe assessment on you today. Can you go ahead and tell me your name and date of birth, please?
My name is William Finger. My date of birth is 02/20/1995.
Okay. And then real quick, do you know the day of the week?
It is Tuesday.
Okay. And do you know where we are right now?
We are in Saginaw, Michigan.
Perfect. And then real quick, I'm just gonna get a little bit of a medical history on you. Do you have any medical diagnoses that I should know about?
Nope,
Do you have any histories or any surgeries in your past?
nope, no medical history or any surgery.
Okay. And then what about your diet? How does that look like?
It's good. I do eat like 3 meals a day. I would say it could be a little bit better when it comes to balancing fruits and vegetables, but it's okay.
Okay, that sounds great. And then what about exercise? How's that for you?
My exercise as well. My daily lifestyle provides a bit of exercise. I would like to exercise a little bit more outside of
Okay,
work.
perfect. And then I'm gonna just ask you real quick about smoking. Have you ever smoked cigarettes? Do you smoke cigarettes now?
Nope, I never have and I don't currently.
Okay. And then how much alcohol do you drink?
Very occasionally, maybe a beer or two on the weekend, I would say.
Okay. That's perfectly normal. And then what about street drugs? How often do you use those?
I don't.
Okay. Um, so now that I've gotten a brief medical history on you, I'm just going to go ahead and move into getting a set of vitals on you. I'm going to go ahead and start with the blood pressure, just to get that out of the way. So strong. Yeah, I'll do that first. Does that feel okay? Not too tight?
Yep, that's fine.
Perfect. Alright, so I'm going to go ahead and put my stethoscope on, listen to your pulse down here, and then get your blood pressure. I'm gonna go ahead and run it out, and then I'm gonna get a blood pressure up here. That way you're not pumped up for so long.
Okay.
Just go ahead and put your arm nice and flat like that. Thank you. Close it. All right, I got about 117 over it's about 85. So that's doing good. You just want to be below 120 over 80, okay?
Oh, great.
Sorry if I made you a little sore.
That's okay.
All right, so real quick, I'm going to take your pulse on your other hand just so I have an actual record of that. I'm going to use this hand though so that I don't use the arm that I just took that pulse out of. Okay, I got about it was about 69. It was like 64 and a half.
Okay.
So I'm gonna go ahead and move into getting the head to toe started. I'm gonna start with your arms. Now go ahead and see these, please. Can you just scooch over so that there we go, a little bit better angle. I'm gonna go ahead and look at the arms. Inspect up and down. Note the muscle tone, symmetry, the color of the skin, the temperature. Noticing and not noticing any lesions or any marks. I'm going to go ahead and palpate the radial and brachial pulses for symmetry. Okay, now I'm going to move up to the brachial pulse. Go like this. Okay, both the pulses are strong and symmetrical. Now I'm going to go ahead and, can you switch back on the bed just a little bit? Sorry. Now I'm going to go ahead and, can you put your hands like this for me? I'm going to check the capillary refill on this finger. Less than 3 seconds, which is good. And less than 3 seconds. Now I'm going to have you put your hands flat on your lap like this and go like this as quick as you can. Okay, perfect. And now I'm going to have you put your hands like this. I'm going to push in on your hands. Don't let me push them in, okay? Perfect. And now don't let me push them out. And then don't let me push them down. And flip the other way and don't let me push them up. Perfect. And then I'm going to have you hold your hands like this. Touch your fingers to your thumb, back and forth as fast as you can. Perfect. And those all checked your cerebellar function in your brain, just to make sure that that was working good. And then I'm going to have you make a fist. Pump your arms up like this, just all the way down. Perfect. Just checking range of motion. And then also to check your range of motion, I'm going to have you make like a swimming motion with your arms like this, back and forth. You can go ahead and do both at one time. Perfect. And then I'm going to do one at a time just to feel, and I'm going to be looking for what's called crepitus in your shoulder, which is like the popping that you would hear. So go ahead and do that arm. Okay, just a little bit. Nothing audible, but I could feel it. I'm going to go ahead and do the other arm. Perfect. And then one last thing, I'm going to stand in front of you, and I'm going to push down on your shoulders, and I'm going to have you do a shrug. Perfect. So those checked your accessory nerve, your cranial nerve number 11, just to make sure that was working for you. All right, now I'm going to move into your head. First, I'm going to check your hair. I'm going to just inspect the scalp, see if there's any pain or tenderness while I'm doing this. Check for any lice or lesions or swelling. Fix it. And now I'm going to palpate the occipital lymph node back here. And then I'm going to move into the post-auricular lymph node behind the ears. And I'm going to move into the pre-auricular in front of the ears. The submandibular. The submental. The cervical chain. And then the supraclavicular lymph node. Right here. All the lymph nodes were soft or non-palpable. And now I'm going to check the tissue turgor right here at the clavicle. Nice easy return on that. And then I am going to check cranial nerve number 5, which is our trigeminal nerve, by having you clench your jaw. I'm going to feel right there for the mastication. Awesome. Okay, and now I am going to assess your face. I'm going to be looking for facial symmetry, any drooping, any abnormalities. Looks pretty normal. And now I'm going to have you make a smiley face, make a frown, and then stick out your tongue. So those all those checked cranial nerve number 7, which is the facial nerve, and cranial nerve number 12, the hypoglossal nerve. Now I'm going to go ahead and move into the eye exam. So I'm going to shine this light in your eye a couple times to check the pupillary constriction in your eyes. And then there's a couple more cranial nerves that we'll check off by doing the 6 cardinal fields of gaze. So first I'm going to have you just look straight ahead. I'm going to put my hand like this. I'm going to shine it in your left eye and look in your left eye. Then I'm going to shine in your left eye and look in your right eye. I'm going to shine in your left eye, check for constriction. Shine it in that eye and look at the opposite eye, check for constriction. And shine it in this eye, check for constriction. And then shine it in this eye and check for the opposite eye. Those all look good. Now I'm going to have you look right here at the pen light. And then I'm going to have you look back here at the window. That's just going to check accommodation in your eyes. So go ahead and look here, look back at the window, look back at the pen, and then back at the window. Okay? So that means that your eyes are curla, which means pupils are equal, round, reactive to light, and accommodate, which is cranial nerve number 3, ocular motor, the parasympathetic function. And now I'm going to check your corneal light reflex, which I'm going to shine a light right here. Just make sure it shines back equally on your pupils. Looks good. And then I'm going to do the 6 cardinal fields of gaze. I'm going to have you look at my pen light and follow it with your eyes, but do not move your head. So look here, up, down, and then over. And that checks the other half of ocular motor, which is cranial nerve 3, cranial nerve 4 and 6, which are trochlear and abductions. And now I'm going to go ahead and this one last one is part of cerebellar function as well. I'm going to have you touch your nose with your finger and then my pen light 3 times. So back to the nose to the pen light, back to your nose to my pen light, and then back to the nose to the pen light. Perfect. And now I'm going to... Is everything for your eyes? I think so. Yep. So now, I'm going to actually palpate your eyes. I'm going to have you look back. I'm going to pull up on your eyes. I'm going to have you look down. Okay? And then I'm going to pull down on your eyes and have you look up. Perfect. And then I'm going to squeeze right here, make sure there's no discharge from the conjunctiva. I'm going to palpate the maxillary and frontal sinuses. Squeeze them, make sure there's no pain or tenderness when I do this. No pain or tenderness?
No.
Okay. Kind of nodded, so I want to make sure. All right, so that's both the sinuses are looking good. Now I'm going to look at your ears. I already palpated the post and preauricular lymph nodes, so I'm just going to inspect them. Look at the pinna. It looks like you've had piercing in the past. I am going to look inside, even though I don't have an otoscope. I'll go to the other side. Excuse me. I'm going to look around, palpate it. And I'm just going to look inside really quick, make sure there's no redness or drainage. All right, and then before I move into your nose, I'm going to check your sense of smell. So can I have you close your eyes, please?
Mm-hmm.
I'm going to wave something in front of your nose, and I'm going to have you tell me what that smells like to you.
Smells like mouthwash to me.
Perfect. So that checks cranial nerve number 1, the olfactory nerve, just to make sure that your sense of smell is working adequately. Now I'm going to check your nose. I'm going to palpate it. I'm going to feel for any deviated septum. And have you lean back just a little, and I'm going to look up there, make sure there's no redness, normal mucosa, normal nose hairs. And then I'm going to move into your mouth. I'm going to sanitize my hands really quick.
Good idea.
And then baby spoon to go ahead and look in there. I'm going to have you open your mouth and say ah for me real quick while I look in there. Okay, that checks cranial nerve number 9 and 10, the glossopharyngeal and the vagus nerve. I'm also going to, let me pull this back out. I'm going to look in there, pull it to the side, so you have some cavities that are filled. Some wisdom teeth back there. And then just real quick, you can stick your tongue out a little bit. See some tonsils that are still intact. And then I'm also just going to pull your teeth up like this and look at them. They all look good. think that's everything on your face. So, can you turn around? I was going to walk around to the other side of the bed, but I don't think you can to see.
No.
And then, can you take your shirt off? Okay, so now that I'm back here, I'm going to, first of all, I'm going to palpate your neck for your trachea, which she can't see, but I'm going to go ahead and have you, I'm going to hold this. Do you have any history of thyroid problems?
Nope.
Okay. In your family, I'm going to have you, I'm going to push right here, I'm going to have you lean your head back and swallow. Perfect. I was just checking for no hardness, is normal, palpable. I'm going to go ahead and down and have you take a nice deep breath in and out. And check for symmetry when he inhales, which they both expanded equally. And then I'm going to percuss on the lungs fields. I'm going to start up here at the top. Down a little bit. Loud. Like, trying to hit it so that she can still see with the camera. Okay. Sorry. Okay, so I've percussed the lung fields. I heard resonance, which is what we want to hear. Nice and clear sounding. Now I'm going to go ahead and auscultate the lungs. All right, so I'm going to put my stethoscope on 6 spots in your back, and I'm going to have you take a nice deep breath each time. There's no rush, so don't breathe too quick. I don't want you to hyperventilate. All right. So I'm going to go instead start right here. You can go ahead and take a nice deep breath. Okay. Move over a little bit. Take a nice deep breath. Perfect. Move down. Take a nice deep breath. Great. And then right here, go ahead and take a nice deep breath. Move down just to the bottom lobe. Go ahead and take a nice deep breath. Perfect. Then one last time for me. Nice deep breath. Okay. Your lungs sound nice and clear. There's no wheezing, no crackles. Now that I've listened to the lung sounds, I'm going to go ahead and have the patient lay down. I'm going to listen to his heart sounds. Yeah. Yeah. I'm going to go ahead and move this camera so that we have a little bit of a better view here. Can't really. I'm going to be able to see like what I'm doing. Maybe I should open it up a little bit. No, I just want it to be just a little bit better like, view. There we go. Instead of just like a side view, it's a little bit. That's good. Okay. Oh, I don't know if she can be able to. Oops, I'm grabbing the wrong thing. Huh? I don't think it's gonna. Okay. Can she see what I'm doing? Yeah. Okay. Okay, so I'm gonna go ahead and listen to your heart sounds. I'm gonna first check your carotid artery and look for any JVD, jugular vein distension. And then I'm going to auscultate the carotid artery with the bell of my stethoscope to listen for bruits right here. No, nothing heard on that side. There we go. Had to push a little bit harder because your beard. I started crackling at first. Okay, so I didn't hear any bruits in the carotid artery. I'm going to go ahead and listen to the heart sounds now. I'm going to start on the right side. Go ahead and start with the diaphragm. I'm going to go to the second intercostal space. So here's the clavicle, first rib, second rib. So second intercostal space to the right of the sternal border. I'm going to listen to the aortic valve. Then I'm going to flip it over and listen with my bell. All right, and then I'm going to go right across the sternal border to the second intercostal space to the left of the sternal border to the pulmonic valve. And then I'm going to switch and listen with my bell. And then I'm going to move down to the third intercostal space, left of the sternal border, which is Erb's point. Very strong S1, S2. Listening for any bruits or murmurs, which I do not hear. So I'm going to go to the fourth intercostal space, mid-clavicular line, and listen to the tricuspid valve. I'm going to listen with my bell. And then I'm going to go down to the fifth intercostal space, mid-clavicular line, and listen to the mitral valve for 1 full minute and get the apical pulse. Okay, I got a heart rate of 69. I'm going to go ahead and listen with my bell. Okay, I didn't hear any bruits in any of the arteries. I'm going to go ahead and move into the abdominal assessment. I'm going to start by inspection. I'm going to look at the patient's abdominal cavity. I'm going to get down. I'm going to get eye level. I'm going to inspect. Can you just move your hands a little bit? For contour, for shape, for any pulsations, protrusions, or discoloration, which there are none. So I'm going to go ahead and move into auscultation. I'm going to start with the arteries of the abdominal cavity. I'm going to listen with my bow. I'm going to go ahead and start with the aorta. I'm going to move over to the renal. I'm going to do the iliac. Okay, and then I'm going to palpate and also take the femoral artery. So I'm going to go ahead and reach under your shorts here. And now that I found it, I'm going to go ahead and listen. Okay, now I'm going to go ahead and go to the other side. Now that I found it, I'm going to listen. Okay, I didn't hear any bruits. Sorry. Now I'm going to go ahead and listen to the abdominal sounds, to the bowel sounds, listen with the diaphragm. I'm going to start in the right lower quadrant. I'm listening for 5 to 30 bowel sounds. Make sure she can see what I'm doing. now I'm going to move to the right upper quadrant. Move to the left upper quadrant. Okay, now I'm going to move to the left lower quadrant. Okay, I heard adequate vowel sounds, more than 5 in each section. So now I'm going to go ahead and move into percussion. I'm going to start in the regular quadrant again. Do the right upper quadrant, left upper quadrant, left lower, and then I'm going to go up from the right side and find the liver right about here. Go ahead and percuss that and hear a difference of a dull sound rather than resonance, which I heard in the rest of the abdominal cavity. Now I'm going to go ahead and move into palpation. I'm going to start with light palpation right here in the right lower quadrant. Now I'm going to move up to the right upper quadrant. Just light palpation, just pushing with one hand. Is there any pain or tenderness as I'm doing this?
No.
Okay, now I'm going to move into deep palpation. I'm going to use both hands. I'm going to really try to feel the organs that are underneath. I'm going to palpate. I'm going to do deep palpation on this side. Do it right here as well. Okay. Now that I've completed the abdominal assessment, I'm going to move into the legs. You can put your shirt back on if you want. If you're cold. You seem cold. Okay, now I'm going to go ahead and first I'm going to look at the legs. I'm going to assess them for muscle tone and symmetry. I'm going to feel them for cool or warm temperature, which they feel about normal, a little chilly because he has shorts on. I'm going to check for any edema, any swelling, any varicose veins, which I don't see any of those. Now I'm going to palpate the arteries. I already palpated the femoral artery, so I'm going to go ahead and start with the popliteal. I'm going to have you just put your foot up, or your leg up just like this. I'm going to feel back here. Go ahead and push kind of deep. Feel it. Okay, and now I'm going to do the other popliteal artery, right behind this knee. I'm going to push in there. Okay, and then I'm going to go down the leg. I'm going to look for, and I'll just remove both your socks right now. I'm going to palpate the posterior tibialis artery. I'm actually going to palpate those for symmetry. Okay, and then I'm going to palpate the dorsalis pedis veins on the top of the foot for symmetry. You have nice strong ones. Just weird. Okay, those are nice and even. And then I am going to do, we're going to check your sensation in your leg. We're going to do what's called sharp and dull. So I'm going to have you, when I tell you, I'm going to have you close your eyes. And then I'm going to touch I'm going to touch your leg. I want you to tell me where I'm touching and if it's sharp or dull. So this is going to be sharp. And this is going to be dull. Do they feel different enough that you can tell?
Do it again. Oops. Sharp. Dull, yeah.
Well, this is sharp.
Oh, and dull.
Yeah, I can use like 2 different things. I can use like sharp, dull.
That's better.
Okay, so I'm going to have you close your eyes. I'm going to do this in 8 different spots. I'm going to have you tell me where, like I said, where I'm touching and if it's sharp or dull. So go ahead and close your eyes.
Sharp left thigh. Dull left foot. Sharp left foot.
Top or bottom?
Bottom. Sharp bottom right foot. Dull top right foot.
Yep.
Sharp right bottom leg. Sharp right thigh.
Okay. Was that one? Okay, so yeah, I did this like two. Close your eyes.
Sorry.
It's okay.
That's dull left thigh.
It's your thigh?
I mean left shin.
Okay, well you got 6 out of 8, and that's what you need to
Calf.
pass. So barely.
Really?
Okay, so now I've done your feet, your legs, arteries. I'm gonna go ahead and had you sit on the side of the bed. I'm gonna check your patellar reflex. Did you see like the no, follow computer? Okay. I want to still be able to see because I have to like pop your leg. Okay, so have you scooch just a little bit more forward, but don't let your feet touch the floor. I'm gonna have you dangle them. I'm gonna check your knee reflex. Okay, I'm not gonna bend down that much because I don't want you to get me. Okay, so I'm gonna check right here. I'm gonna go ahead and like that. That one's good. Check right here. Maybe 1, 2. No, that's not it.
Close.
Oh. There we go. Okay, so those are both good. Now I'm gonna grab your socks and your shoes for you. Don't get up. Do you here's your socks and your shoes.
Thank you.
Do you feel okay? You're not dizzy at all?
No.
Okay. I'm gonna have you put those on for me. And then we're gonna stand you up. I'm just gonna move this a little bit so we can still see what we're doing. So yeah, don't stand up yet. Okay. So first I'm gonna have you stand up. I'm gonna stand right by you, make sure you're not dizzy. You feel okay? Don't walk anywhere yet. And then I'm going to have you stand shoulder width apart with your feet. Sorry. And then have your arms at your side but not touching. And then I'm gonna have you close your eyes. Okay, that was you can go ahead and open them. So that was just me testing your Romberg, which was negative, which is a good thing. That just tests cranial nerve number 8, the vestibular cochlear nerve, just your balance to make sure that you're steady on your feet before we walk you.
Okay.
Okay, so we're going to stand like this. We're just going to walk to the table. Just regular, normal walking. Then I'm going to have you turn around and then walk heel to toe for me, please. Okay, perfect. So based on your diet, your exercise, the moisture of your skin, how much time you spend in bed, I'm going to go ahead and give this patient a Braden scale of 23, which is our highest score that you can get, which means that you are at 0 risk pretty much for pressure ulcers.
Oh.
Otherwise, I think I got everything. Thank you so much.
Thank you for your time.